Okay, well, everybody is worried about endometriosis, and it's an over concern. Um, okay, most women that have painful periods are told by their gynecologist maybe it's endometriosis. And it's true that having endometrial tissue in your peritoneal cavity or in your ovary or in your uterus can cause painful periods, no question. But the majority of painful periods are not caused by endometriosis. Sometimes periods are just painful, and you can solve the pain of a period just by going on birth control pills or Mirena IUD, and you can be over, not have to have painful periods. Uh, but endometriosis is overdiagnosed as a cause of infertility. There are two situations in which it can cause, well, three, I'll tell you, in which it can cause infertility. If it's in the uterus, the endometrial glands growing into the uterine muscle, that's called adenomyosis. And we are among the major authorities in the world on that because we can do surgery to correct adenomyosis. It's very tricky surgery. It's not like a fibroid, it's very tricky. But adenomyosis can cause painful periods and cause infertility, but not if it's minimal lesion adenomyosis. If it's just minimal lesion adenomyosis, you can get pregnant just fine. It's only when it gets bigger that it causes miserable periods and infertility, but we can solve that. Second thing, if it's in the ovary, a endometriosis in the ovary can spread out and flatten out that outer cortex where all the eggs are so that they don't recruit and they don't develop. And so endometriosis inside the ovary is something that has to be taken care of. But the vast majority of endometriosis are these little implants in the peritoneal cavity. And the only problem with those implants is aggressive surgeons will go in and ablate them and cauterize them and laserize them and ablate them and do all kinds of surgery. And that results in adhesions, which can prevent egg pickup. So then they go in again and do another laparoscopy a year later, and they do more ablation. And before you know it, it's iatrogenic. What I mean by that is the surgical intervention in an endometriosis that otherwise is harmless really does cause infertility. So I wouldn't, if the endometriosis doesn't show up on ultrasound, then don't even think about trying to make the diagnosis because it just doesn't matter. If it shows up on ultrasound, it's either in the uterus or it's in the ovary. And actually, most ovarian endometriosis anyway can be dealt with just with simple needle aspiration. Do a needle aspiration, put the patient on a anti-GnRH antagonist or agonist, and then do IVF. And then once you're pregnant, of course, the endometriosis melts away anyway. So I wouldn't worry so much about how do I know if I have endometriosis. I wouldn't do diagnostic tests for that.